Did you know that men are most likely to suffer a heart attack around age 65, and for women the risk peaks closer to 72? It's a frightening statistic, but even more alarming is how many people don't actually know how to protect themselves. So let me ask you a simple question. Do you know if you have plaque in your arteries? My name is Dr. Ford Brewer. I've been practicing preventive medicine for over 4 decades, taught at Johns Hopkins, and I still spend my career helping people avoid life-threatening events like heart attacks and strokes. Today, I'll show you a surprisingly simple way to check for arterial plaque at home using nothing more than a blood pressure cuff. Imagine this. You've been getting a little chest tightness during exercise, maybe some fatigue you can't explain. You go to your doctor, and after a few tests, you're told your cholesterol is high. You're handed a prescription and told, this pill will take care of it. You leave with questions swirling in your head. Why do I even have cholesterol clogging my heart? What did I do wrong? I'm healthier now than I used to be, so why am I sick? Here's the truth. Cholesterol is not the whole story. The real danger comes from arterial plaque. Most people think it's just fatty buildup lining the artery walls, but that's not accurate. Plaque is actually an inflamed, sticky mess, more like mucus than candle wax. It's driven far more by inflammation than by cholesterol alone. And here's the scary part. If that inflamed plaque ruptures, it spills into the bloodstream and triggers a clot. If the clot blocks blood flow to your heart, that's a heart attack. If it travels to your brain, that's a stroke. This is why testing for plaque matters before you start medications. There are many ways doctors can detect plaque, but the easiest one you can try at home is called the Ankle-Brachial Index, or ABI. Quick safety note, if you've been diagnosed with deep vein thrombosis or you experience severe leg pain, skip this test and talk to your doctor. For everyone else, here's how it works. Grab a blood pressure cuff, a pen, and some paper. Rest for a few minutes lying down. Measure the blood pressure in both arms and both ankles. Write down the highest systolic number for each. Now calculate. Divide the highest ankle reading by the highest arm reading. For example, if your ankle reads 126 and your arm reads 114, your ABI is 1.1. So how do you interpret that number? Between 1.0 and 1.4 means your arteries are likely healthy. Between 0.9 and 1.0 is borderline but generally acceptable. Below 0.8 suggests plaque buildup, restricting blood flow. Above 1.4 indicates your arteries may be stiff or hardened. Why compare arms and ankles? Because your leg arteries face tougher challenges. They're narrower and rely on muscle movement to stay flexible. By checking both, you can spot early signs of peripheral artery disease, or PAD. PAD is no joke. It causes leg pain, cramps, swelling, even hair loss on your legs. Worse, it's linked to much higher risks of heart attacks and strokes. Now, what should you do with your results? If your numbers look good, congratulations. Your arteries are likely healthy, but don't get complacent. ABI is great for spotting severe issues, but heart attacks can still occur with subtler problems. That's why lifestyle and deeper testing matter. If your numbers are concerning, don't panic. What matters most is that you caught it now. The earlier you know, the earlier you can act to protect yourself. So instead of just relying on a pill, you can take control, understand your plaque, know your risks, and make the lifestyle changes that stabilize and even reduce dangerous buildup. If you want to see exactly what those changes are and how I personally lowered my own risk, check out the next video where I break it all down.